But we are here today to honor and thank the generosity of two families who have given us incredible support that we're going to find out more about today. Lindsay Gordon, the UBC Chancellor, and his wife, who cannot be with us today, Elizabeth. Can I say why? Okay. And the North family, Rudy, Patricia, Caroline, and Rory. UBC has been an international leader in establishing collaborative relationships with Aboriginal communities in many ways. And the direction shared by this university's Aboriginal Strategic Plan demonstrates this quite clearly. UBC's leadership was confirmed last year when the Centre for Excellence in Indigenous Health opened its doors for the first time, aiming to bring together the best models and the best people to support the Aboriginal Health Initiative. But most importantly, to find passionate and committed people from across the areas, inside of UBC walls and outside of UBC walls, who are willing to understand the importance of what this was for, what impact it could have, and ultimately downstream the benefits that we would see and celebrate together. Today marks an important day for the Centre's short existence. The receipt and support will enable our Centre for Excellence in Indigenous Health to really ramp up its activities in many ways and to start new programs that were just once a dream.
As most of you know, we've made Aboriginal engagement one of the top priorities for UBC. And we've seen Aboriginal initiatives multiplying rapidly across our campus. Let me just give you some examples. Our Indigenous faculty count has now more than doubled. We have 60 student awards dedicated solely for Aboriginal students. We have professors such as Cheryl Lightfoot and Patricia Spittle who are conducting core research on Aboriginal issues. And of course, related to today's announcement, but I think maybe coincidentally, we announced last week that the Faculty of Medicine's Aboriginal Admissions Program has met its target of 50 students graduating. And that's a full 5 years ahead of target. So we achieved the target this year, and originally we targeted 2020. So I think that's a monumental accomplishment. Now, while we can be very proud of these milestones, I think it's also fair to say that not enough has been done and that we need to do much more. The reality is that Indigenous students are still underrepresented in healthcare programs. And I think that some of that shortfall is the reason that BC's Aboriginal peoples have lower life expectancy, higher infant mortality, higher rates of youth suicide, higher incidence of diabetes, and so on. It's one of the reasons that we created the Centre of Excellence in Indigenous Health last year to tackle some of these issues head on. That centre was established in consultation with Aboriginal communities, First Nations Health Authority, educational partners, government, and nonprofit groups. And our centre is committed to working broadly with communities to improve the physical, mental, spiritual, and emotional health of Aboriginal peoples and communities. The centre in particular is dedicated to engaging and training, mentoring Aboriginal students to become the next generation of Indigenous health professionals and scholars in BC, Canada, and beyond. At a time when primary responsibility for Aboriginal health in BC is increasingly shifting to communities, it's never been more critical that we expand our training of Aboriginal health professionals. Against that backdrop, two very civic-minded and forward-thinking families, Gordons, represented here by Lindsay, and his wife Liz, who can't be with us, and the North family, we have Rudy and Patricia, and do we have Caroline and Rory here too? And Caroline and Rory couldn't be here. Came forward and came together to help UBC realize their goals. Each family has generously donated $1 million to our Centre of Excellence in Indigenous Health. Combined, these two gifts will enable us to build long-term partnerships. They'll increase opportunities for Aboriginal students to pursue higher education. They'll produce more graduates with knowledge and understanding to work effectively with Aboriginal colleagues, clients, and communities in healthcare professions. And I think even more than that, I think that these particular gifts show what happens when different communities come together to tackle really fundamental social issues that we face in society. So, Lindsay, Rudy, and Patricia, I want to thank you on behalf of the entire UBC community, on behalf of our Aboriginal partner communities, and I'd say on behalf of all British Columbians, for doing something which has the real potential to address the kinds of challenges I outlined. It has the potential to look at issues of life expectancy, infant mortality, look at potential for decreasing diseases such as diabetes. And it allows us at UBC to work as equal partners with our Aboriginal communities.
In addition to my role as Chancellor, I've been very proud to serve as the co-chair of UBC's Start an Evolution fundraising campaign, Start an Evolution. And we made a personal financial commitment some time ago, but we weren't sure what exactly we wanted to support. The campaign, the Start an Evolution campaign, was based on the idea that partnering with UBC allows people to start an evolution, to spark an idea, catalyze a project, or inspire a student to change the world for the better. So Liz and I began our search for the right UBC partners to help us make a real difference in the lives of Aboriginal people. And I actually remember calling, where's Barbara Miles? Yeah, Barbara. I remember calling Barbara and saying, well, here's some ideas. And she said, I want you to meet Nadine Caron and Martin Schechter. And it was, as soon as we met these two, we knew immediately that they were the right people for us to partner with. As co-directors of the Centre for Excellence in Indigenous Health, they understand how critical it is to work collaboratively with Aboriginal communities, both to address health disparities and to connect Aboriginal youth with opportunities to pursue health education and become the next generation of health leaders. Liz and I have great confidence in Nadine and Martin's ability to make the Centre for Excellence an impactful reality. So together with the North family and others, we are thrilled to be supporting the Centre for Excellence, and we hope that our investment and partnership, we hope and expect our investment and partnership with UBC will help more Aboriginals to fulfill their dreams and to make a tremendous and positive impact on their communities.
We know that in many areas, there are many diverse areas of healthcare professions, but I know that through the UBC Centre for Excellence in Indigenous Health, more and more youth from this province and beyond will be inspired to serve their own communities and others as healthcare workers. Our family is thrilled by the prospect of working and watching this project develop. By 2030, the progress will be great, and all our children and our grandchildren will live in a healthier and happier place. Thank you.
As you've heard, these two gifts from the North and Gordon family are focused on growing the next generation of Aboriginal health care providers across the disciplines of healthcare. It's only fitting, then, that we have one of those future healthcare professionals with us today to describe their journey to date. Ellie is starting her third year of medical school, and I learned today that it's her first day of her third day of medical school. This is a big day for her. It's already rolling off the tip of her tongue quite well. She is a member of the Waiwakum Band of the Wakwakawak First Nation. Growing up on the reserve, she saw from a very young age the health disparities affecting our First Nations population and wants to advocate for Aboriginals to stand up for our right to excellent health care and to address the gap in access to healthcare services.
I was honored when UBC asked me to speak at today's event because I feel my journey thus far represents an example of what the Centre for Excellence in Indigenous Health is striving to achieve. I'm a Canadian of Aboriginal descent who, with some encouragement and assistance, is well on my way to becoming a health professional. When I received that assistance, just about 5 years ago, I was a first-year university student with a vague idea of becoming a doctor, but I had a lot of self-doubt for numerous reasons. Growing up as a member of the Weebekam Band of the Kwakwaka'wakw First Nation in Campbell River, I didn't see members of my community working as health professionals, with the notable exception of a dental hygienist. I also wasn't a very diligent student. I didn't know very many people who went to university. The idea felt unattainable at best, so school felt like just a hoop to jump through, and my grades reflected that attitude. I actually dropped out of high school at the age of 16 when I was faced with an unplanned pregnancy. I could have let that set the boundaries for the rest of my life. But during my visits to my doctor throughout my pregnancy, I realized how much help he was providing to me, how fortunate I was to be receiving such support, and how much need there is for more people like him. And I wondered if I could help fill that need. It was a crossroads for me, and I made the decision to go down another path than the one I had been on. Instead of never returning to my studies, which is what so many people expected of me, I re-enrolled and I started to focus on my education for the first time in my life. I not only graduated, but I was admitted to the University of Victoria, where, against the advice of my high school counselor, I majored in science. It was during my first year at UVic that I attended a pre-admission workshop organized by UBC for students who were considering medical school. After attending the workshop, I realized that becoming a doctor was a real possibility, and I'm looking at James Andrew, who is behind all of it. Those workshops and the continuing assistance I received during the application process were crucial in counteracting all of the doubts and discouraging messages I had been receiving up until that point in my life. Now that I'm a medical student at UBC, I am helping to allay the doubts and discouragement of other Aboriginal students by attending these workshops as an advisor, helping them see that their futures do not have to be defined by their past nor their present. So I'm gratified to hear that some of the financial support that we're talking about today is going to such workshops and mentoring. I'm also gratified to hear that some of it is going to student financial aid. I myself have been supported by 3 separate scholarships, without which I would not have made it as far as I have today. I still have quite a long way to go, 2 more years of medical school, then 2+ years of residency, depending on what area of medicine I choose to specialize in. But I know this for sure. When I have completed my training, I intend to fulfill my original motivation for going down this path. One way or another, I will help Indigenous people get the care they need and the care they deserve. I have seen that need firsthand. I have seen members of my community failed by our medical system as they try to overcome addiction, and then I've seen them succeed thanks to a program run by the Namgis First Nation in Alert Bay that is more attuned to our culture. I have seen members of my community avoid going to the doctor because I have been alienated by judgmental health providers who have lectured them about their lifestyle instead of providing sympathetic, holistic care. Those are just 2 examples of why we need more health professionals who are of Aboriginal ancestry. We have an inherent understanding of the challenges faced by our members of our community. Those challenges may take many forms: mental health issues, financial issues. In many cases, they are the behaviors of the legacy of negative experiences as notorious as forced attendance in a residential school, or as private as a humiliating lecture from a doctor. We also understand our community strengths: the spirit of cooperation, the respect for tradition, the conviction that health is a matter not just of body, but of spirit. Aboriginal health providers, having been raised in that environment, are ideally positioned to leverage our community's finest attributes in the course of providing treatment and preventing illness. We can collaborate with other health providers interested in Indigenous health to help fine-tune cultural humility skills as we work together to improve disparities. I mentioned earlier that I didn't see any Aboriginal health professionals growing up, except for the dental hygienist, but she was an exceptional role model because she wasn't content to just do her job. She also made a difference. She convinced her clinic to alter its payment policy so that patients wouldn't have to pay out of pocket for services and then seek reimbursement themselves, which was a significant disincentive to those seeking dental care. As a result of her efforts, The clinic provided services to members of my community without requiring payment up front, and the clinic dealt with the reimbursement process. It was a small step, but it made a large difference in helping to break down barriers to care. We need many more of these small steps because it will add up to a huge leap for Indigenous health. The gifts that we've announced today will enable those many small steps and that huge leap. So I would like to personally express my gratitude to Lindsay and Elizabeth Gordon, and to Rudy, Patricia, Caroline, and Rory North for having the vision to support the Centre for Excellence in Indigenous Health. Yes, it will have a direct benefit for people like me, Aboriginal students who want to become doctors, nurses, dentists, pharmacists, or other health professionals, but more important, it will benefit the communities from which we come, communities to which we owe so much. Thank you. Gaila Caslow.
Well, if Elliot is at all a representative of the future of our healthcare profession in the hands of Indigenous professionals, then I think we can all be rest assured we're heading in the right direction and we're safe. I would now like to ask Chief Wayne Christian, he's Chief of the Slatzine, to say a few words on the impact of the Centre on our Indigenous communities.
So I come here today and to honor the families of the Gordon family and the North family. You know, I really would have to say that it's really an important time in our history in British Columbia. You know, the Centre for Excellence in Indigenous Health is really about advancing health through education, innovative thinking, research, and traditional practice and leadership. And I would have to say that these two families, by what they're doing, have practiced those things in their lifetime to be able to do what they're doing here today. And the other two values that I think that we share in common as Indigenous people in these families is really the values of hard work and planning. You know, we wouldn't be here, I always say to our people, if our families and our ancestors didn't work hard and plan for what was to come. And I think by what these families are doing, they're helping us in terms of planning for the future. And really, and talking about it, you have to think about it in this way. The investment that's being made is going to change lives. It's going to do more than change lives, it's actually going to save lives. What do I mean by that? You heard a young student got up and speak about what she plans on doing in the medical field and becoming a doctor. She will save lives.
But I do want to recognize Dr. David Patrick that's here. The Centre for Excellence is actually housed at the School of Population and Public Health, and he's been instrumental and so supportive. Of course, Lynn Kessler came up and he opened up this event. What he didn't explain is he's also been an absolute rock, a foundation, and as someone that we turn to for incredible amount of support, wisdom, advice, and he actually is one of the people that oversee the Centre. And so for the Gordons and the Norths, essentially when you're looking at Martin and I and our Centre for Excellence team, we go to David Patrick and we go to Lynn Kessler for the advice to make sure that what you have invested in, we promise we will do what we said we'd do with our goal to have that impact that Wayne believes in, that we can do. I'd also like to express gratitude to the First Nations Health Authority. Some members of them are here. You can't really work in healthcare in British Columbia without involving the First Nations Health Authority, without partnering with them, and without collaborating with them, and more importantly, without just listening to them. Because they are actually behind the healthcare services for the First Nations population in British Columbia, and they've given us incredible guidance. We have the advisory councils, both a community advisory council and a university advisory council that also guide and give us wisdom. It is a big team, and I want to thank all of them. I'd like to thank now, on behalf of Marty, myself, and our Centre for Excellence team, express incredible gratitude. Words can't really do it justice to the North family and to the Gordons for their vision, for their leadership, for their support. And we talked about it when we met the other night, for their trust. How do you give that much and support that much without trusting what you're believing in and putting it out there? Your gifts will accelerate UBC's recruitment and education of Indigenous health professionals. We had a beautiful, perfect example of what is our future. And these individuals will be the best to eliminate our community's persistent health disparities to date. and promote our self-sufficiency in healthcare. Investments like this are crucial for ensuring that our centre can not only continue what we do, but to build programs on top of that to expand what we do in each direction that we focus on. And always, always, at the end, for the purpose and the benefit of our communities. Thank you to Lindsay, Rudy, and Patricia, who were able to make it here today, and to your families who I know are here with us in spirit, for this momentous occasion in this beautiful, beautiful building, and really, really look forward to your continued partnership with our centre, and of course with the university. One of the quotes that I use at that, I think I'll end with today, is, I love this quote: "A society grows great when old men or women plant seeds for trees, in whose shade they know they shall never sit." I want to thank the Gordons and the Norths. This is a big, big endeavor. You will see seedlings. You will see shoots. You will see some flowers and some blossoms. You may not be around. I won't be around, maybe. Maybe none of us were around for a huge tree with lots of shade. We have leaders who will pass that tree over to. So thank you for planting those seeds. Thank you for having the courage to believe in us.